Okay, thank you so much. And I will give a heads up, I cannot show screenshots, so I've done some mock-ups to show you kind of what I'm talking about. So gonna go over designing orders in an EHR. So what are orders? Orders are directions or instructions how to care for and treat patients. And orders must be followed. So if a provider puts something in and the nurse receives it, that's something you're expected to do. As a nurse, my focus is on nursing orders, which includes things such as assessments, notify orders, vital signs, and not as much, or I don't consider nursing orders medications or labs, but those are orders. And to give some context, there's over 2 million nursing orders that are put in each year and over 6,000 inpatient nursing orders put in each day. So there is a lot of information that's coming in, and the provider has to be able to put that in, and then nurse has to be able to digest all of that. So there is a lot of EHR burden because of all this information. And so that's really where I come in, and I partner typically with providers to try and figure out how we can improve how those orders look and function so that it's easy for the provider to be able to enter that and easy for the nurse to be able to digest all of that information. Okay, so I'm gonna jump into giving you a little bit more how orders work. You have to have someone that can be able to find the order, place the order, acknowledge the order, view the order, and then someone has to remove the order. And so typically, a lot of times someone just enters the order and they don't necessarily think about how it looks downstream. They enter a bunch of text, you get a paragraph, and then someone has to say, okay, how am I going to go through and figure out what all I'm supposed to do for this patient? And typically it's very important information. And so as a nurse, my goal is to try and figure out how we can make these orders in a more consumable format for nurses. And so this is some information that you can see that's in a nursing order. So you can see kind of the priority of the order, the frequency. We can put questions in there. Some of them are free text, some of our question and answers. They can put comments, which is something that's editable within the order, instructions that is non-editable that we put in on the back end, and then we can put links to information. And typically those links have to be in our policy documentation. So this is one of the examples that I had to deal with where we had an order name, and there was two orders. One was called strict intake and output, and the other one was called intake and output. And we went around and we asked the nurses and the providers, well, what is the difference between these two? And we got different answers from everyone, which is concerning when you expect, the provider has an expectation and the nurse has a different expectation, which that means the patient may be not receiving the care that they should be receiving. So what we went in and did is we changed that around. We put one name in and then we added questions. So we added, like, what is the expectation for intake? What is the expectation for fluid output? What is the expectation for stool output? Do you need to know, do you need everything to be measured? Do you need me to weigh that diaper? Or do you just need to know that, yes, the person went to the bathroom? And that can really drive patient care. And so these changes are really important, especially in a hospital setting. Another thing that people typically don't think about very much is the frequency of an order. So when we looked at data, we found that the most frequent frequency for intake and output was until discontinued, which inherently, if you look at that, you're like, well, what does that mean? Does that mean I should get it whenever I feel like it? Does it mean I should get it at a minimum amount of time? And when we talk to the providers, they're like, well, at a minimum, we typically want you to get every shift, or we need it every hour to be able to drive patient care. So we were able to change that around, which is really great. Another thing is comments, instructions, and reference links. And this is where we put a bulk of our information. And on the left is an example of what was in our comments previously. So a bunch of just free text. And so we have to figure out, again, what should go in comments, which is editable, what should go in instructions, that's something that should apply to every single patient, and what should go in our reference links, so something that links out to another site and doesn't have to actually be within the order. And there are strict guidelines that we have to follow about what has to be in an order and what doesn't, especially with our regulatory bodies. But it's been a really fun challenge to figure out what really needs to be within those orders to make it better. So thank you.